Hello everyone, how we doing? I am Dr. Nathan Hoffman. I am the founder of Chicago Dental Studio, the CEO, and also the head cosmetic dentist. Luxury brand, I think, screams service and quality. That's really the pillars of the Chicago Dental Studio. You're always going to have a level of customer service where people will be accommodating, understanding. I've always told my team and everyone to treat people like you would want to be treated. It's something that's missed in businesses a lot in general. And I'm sure you guys have all dealt with something as a consumer, as I have, where you're like, why is this so hard just to try to make your customer happy? My goal is to make sure myself and my team are aligned. My patients don't have to feel that. Quality would be the second pillar, and dentistry itself as a service is kind of a product, and you want to make sure that you're doing good dentistry. The quality of the work so it lasts, so patients don't have pain, so patients are happy with the aesthetics. Those are things that are super important. I think the overall atmosphere is really important as well. When I set out to build the Chicago Dental Studio, I always wanted it to feel not like a dental office. And at the time, 10, 12 years ago, this is very innovative. There wasn't a lot of dental spas, dental salons, dental studios. We were thinking outside of the box, but it was really important to me to have that feel. I also knew that my future was going to be cosmetics. And as I started to build that, I felt like you should have an elevated feeling when you come to my offices. Trust the team that you're working with. Technology is super important as well. There's things in our world that are constantly evolving, and technology is probably at the forefront of that. Obviously, you don't want to jump into something that's brand new without having any testing or anything like that. But generally, once it's established, it's going to make your life easier, the patient's experience better, but it's also going to make your product or the service better as well. The speed bump for that is cost, because technology costs a lot of money, and quite frankly, most dentists probably can't afford that. But to me, I've made it a top priority to always reinvest in the business, and I would so much rather make sure that my studios are operating at the highest level, meaning we have the best atmosphere, we have the best technology, we pay for the best people, because those are the things that really make the experience what it is. And so for me, I would much rather roll all that income back into the company to make it better instead of adding to your checking account. We like to understand what people want, what people need, what are issues sometimes that people have. Let's face it, no one's perfect all of the time. I always tell my team that it's not necessarily about what you do when things are going right, but what you do when things don't go as planned. If that experience or there was a billing issue or something and the patient is unhappy, you have to kind of go above and beyond to make it better. Then the key is you learn from that experience. You try to identify ways to make your systems and your protocols better to then solve for that. Also, there's just a certain level of care that goes into it. And I know sometimes these things seem really simple and yeah, no duh, but the reality is it's not. I make a point, and you'll see me when I'm in here, I'm running around, I'm fist bumping people, and I'm talking to everyone, and I make a point to say hi to every patient that I can and see them, even if I'm not seeing them. I also try to make sure that I say goodbye to patients, say thank you. When they walk through the door, they're gonna get a friendly greeting service. There's a lot of dental bars, hygiene bars that are kind of gravitating away from a receptionist, and sometimes they have a host stand, and sometimes it's all digital check-in. But I just disagree with that. I think you're losing the connection of customer service. Sometimes those front desk employees are the people that they have the most interaction with, they're talking with. Maybe if they're unhappy about something, they're not gonna bring it up to me, they're gonna call the receptionist or send an email. So to me, it's worth the cost and the training and all of those things that go into having a well-trained front of house to make sure that the patients have the best experience. Offering a beverage, gift cards for referrals, all of these things, these little details that really just go into showing your appreciation for the patient and saying thank you for making us your choice. We wouldn't have what we have if it wasn't for all of our patients. patients. When you talk about branding and you talk about, well, what is having a good brand? And I know that there's a lot of conversations these days about that. Having a good brand, it's not just about having a cool logo or having a lot of followers on social media. Branding is about reputation. Every patient experience, every time someone walks through the door, you understand how they're treated as a reflection of the brand, and how they are going to feel like their experience went is important. I say this all the time, but like every day is Super Bowl for me. I'm doing smile enhancements and I have to be perfect all day, every day. People expect it to be perfect. They expect them to be super happy with the result. They expect the procedure and the process and the whole experience to be this luxury elevated feel. It's a lot of pressure, but I love it. And I think I have ice in my veins when it comes to that. I thrive on the pressure. I like that challenge of making every experience special. Doing that, it's not like I do it thinking about the brand, right? It's not like I'm like, oh, I'm gonna do this just so we have like a good review. I treat people like I would want to be treated, and I don't put something in someone's mouth if I didn't want it in mind for the final product. And I just focus on that. The reputation and the branding and the other stuff just comes with doing it over and over and over again. I had a patient that came in after we did like a major smile makeover. What she said, I'm just not fully happy. And she said, you know what? I know that you crush it and I have all the confidence in the world in you, but I just feel like we missed it a little much. And I said, okay, well, what's wrong? And she's like, I wanted brighter, big fake teeth. That's not really me. Most people come to see me in order to get a really beautiful, natural, subtle, very minimal plan that looks very real. Going the big Hollywood, that's not always really my thing. What is my thing is making people happy, and she wasn't happy with what she felt get the result she wanted. We have a very rigorous process where we have approvals and patients sign them. So we say, hey, let's make changes. And so we have like a formal business protocol for making sure patients are happy. And as I'm sitting there with this patient, she was being very positive about it. And I like that approach. I redid everything for her. I didn't charge her a penny just because I felt like it was the right thing to do, and I want my patients to be happy. That's really why I do what I do. It's not always about how you act when everything goes well, but sometimes what you need to do to make things right. At the end of the year, we'll have 8 locations. Each one of those roles is probably a full-time job. Almost all the people in my position stop doing dentistry and they start focusing on working for the business and not working in the business. But people are like, well, eventually you're gonna have to stop doing dentistry, right? I think that is how it allows me to continue to provide an excellent service. First of all, I've dedicated my entire life to mastering this skill of working with my hands and providing a really amazing result for patients. And keep in mind, that's a huge amount of practice and commitment. And I see probably more patients than just about any dentist out there. I can promise you that. For 15 years, I've just been grinding and grinding and getting as good as I can. Why would I give that up? Like, why would I want to stop? That would be a disservice to everything that I worked hard to build. Also, all the patients that I have the ability to help. What I find is being fulfilled is getting really good at this skill, but then helping people with it. I say staying in the dentistry and doing the work is how I continue to maintain the quality and the outcome. Every day when I'm working and seeing patients and seeing how the operations work and seeing how everything's flowing, I then find out what my patients need and what will best serve them. But guess what else? My team. And I know what the team needs and how I build good leaders and how we train and how we coach and how we teach. And so being in it is a big part of that. I think it's important to really care about the skill or the job or something that you have and put all effort into it. What I feel is like that's how I have purpose and that's how I feel fulfilled. I'm almost obsessive trying to be better and trying to learn everything. And I want to soak up as much information as I can and learn as much as I can to be the best version of myself that I can be. But I also think it's a big reason why we've had so much success. Technology, treatment, protocols, it's constantly evolving. Most of the dentistry done out there, not today, is old school dentistry that most people don't have to do it that way anymore. There's still way too many invasive procedures, not enough focus on functional medicine, focusing on fixing bites and all of those things. In the medical field especially, it's really important to stay on the cusp of what's innovative, what's not. And also, I think a general approach to medicine that's more forward thinking is being proactive, being preventative, and doing non-invasive work to avoid those big dental emergencies down the road. The dental space is a very lucrative space, and there's constantly people trying to put some new, better, best product out there. If it doesn't have the research to support it or it doesn't show it, you don't want to start chasing every shiny object that comes out. It's important to do your research, know what to look for, test things before you do it. But the products that have the reputation, they have the results, make things last longer, be less invasive, make things more accurate, and ultimately also make the patient experience easier and less painful. Those are the things that are most important. We have a smile showcase where what we're able to do is take a quick video and a quick photo of people, and then we can transpose their result into this. And so it's not just like a cartoon looking picture of your teeth, it's actually a video of you talking, and this particular program and software is the best I've ever seen, and it looks real. That has been pretty awesome when it comes to visualization and for the patient communication and for showing and explaining. It's a total game changer.